Sorry, it's got a hair trigger. I'm finding out, and many of the resuscitation medications are not approved for pediatric use by the FDA. It's a whole nother project to go through and to study them in children. So often, much of the data is extrapolated from adults, unfortunately, like we have to live with in other
All
settings
right,
in
guys, I think we'll go
pediatrics
ahead
as
and
well.
get started. Welcome to
So my
Pediatric Grand
objectives
Rounds. I'm
today
glad
will
all of you guys
really
can
for you
join
to
us today.
understand how
We
these
have
guidelines come
one of
about,
our very
and the
favorite local
extensive
people
evidence
speaking
evaluation
today. Dr.
behind
Steve
them
Schuxnatter
that
will be
goes into
talking to
guideline
us today
development.
about the most current pediatric CPR guidelines. As you all likely know, Dr.
List the
Schuxnatter
major
is a
changes in
professor
the
of
2020
pediatrics
Now
here
there's two
guidelines, and
people
in
some are
speaking at
internal
one
simply
time.
medicine at UAMS and
reaffirmations
ACH.
of
He's the Section Chief for
things that have
Critical
been
Care
recommended
Medicine.
over the
He
past
has a long-standing history with
generation,
the
really.
American Heart Association and keeping us all on the cutting edge of the appropriate way to give CPR.
Of course, the woman is talking over the dude.
Okay. Well, darn, I don't know what I did. I have done something, and I can't hear them, so I can't get anything out of them. So if I can't get anything out of them, then I'm not going to play it. But that would be a place where you go to get your information is the Arkansas Children's Hospital, and
Before you get started, Dr. Shucks, we do have CME credit obviously today and MOC Part 2 credit. I will put the links for those in the chat.
So you can go in here and you can watch these videos and you can get CEUs for it. That one that was running right there is 55 minutes, and then harm happens. You know what happens to the ACH, and I don't know why I'm not hearing stuff, and I may not be able to. But this is some good information out here for you, and it's on their grand rounds. They have faculty development. They have fellows lectures. There's nursing ground rounds, one team, peds, psychiatric, and resident lectures. So you want to get lectures, you can go out here and pick it up. And there's all kinds of good stuff out here. There we go. Jamie, you look tired, especially when you roll your head back like that.
I'm exhausted. I've been working a lot, and I'm on a double today, so.
Well, you stay safe up there and keep your hands clean. You know what I'm saying?
I do.
Okay. So I got to go out here. Gosh, I got rid of all that, didn't I? Okay. The next thing we're supposed to be covering is pediatrics for Arkansas. Arkansas pediatrics. So, what I thought we would do is we would take a look at the protocols for North Arkansas Regional Medical Center. What do y'all think about that? I can see y'all are overjoyed by that. So, um, we're going to look at the pediatric. Well, is there two separate protocols, or is there just this protocol? Is this the only one? Is that you, Greg? I'm hearing.
Probably. I don't know.
Okay.
Is it closed wrestling?
Yeah, I think so. Well,
yeah, that's me then.
I have only one protocol. There's not a pediatric book for protocol, is there?
I thought it was all included with the same protocol book.
Yep. Well, I have the downloaded protocol book. They sent it to me, and I'm supposed to be reading parts of it. And I haven't seen any of the other stuff there. There is an obstetrical part, and we'll look at that right click. And this is the OB protocol for imminent delivery, and it's protocol 301-16. And let me see. I used to know how to do that. Yeah, page 51. And they want you to evaluate the mother, and they want you to get the number of pregnancies. That's the gravida. There's para and gravida. Para and gravida. Para is the number of live births. These are the ones of babies that have come out. So, why is it important for us to know uh, how many births she's had?
Well, I mean, how many births she's had versus how many times she's been pregnant would indicate that she's either capable or not capable, but has had spontaneous abortion in the past, or otherwise, actual non-spontaneous abortion um, indicates that there could be damage to the uterus, or the uterus is weaker than somebody who's not had any kids before.
Good. Very good.
That, and the more they've had, the faster they pop out.
The time frame. Yeah, the time frame.
Mm-hmm.
Have There you are. I wonder what happened to all. I lost sight of you. I was trying to find you. I couldn't find you. So I had to come back out to see. Because I thought I had actually hung up on everybody. This is frustrating. Oh, there you go.
Big puppy.
So, due date of confinement. That's important to know because that tells us where they're at. We're hoping that they're beyond. What is the date that they always say at this point in time? You got to give them a name and a birth certificate or a death certificate if they're born past how many weeks?
Oh God.
I'm stretching you, ain't I, Greg? I mean, Dan.
Yeah, it's been a while.
Isn't it somewhere between 25 and 26 weeks now that they've changed it to? It used to be 32.
Yeah, it's 26 weeks. Anything beyond 20 weeks or beyond the start of the third trimester, they want you to be ready to take them. Remember the possibility of multiple births. This is off of y'all's protocol, and that's just because if you got multiple births, you're going to need multiple resources. And then you want to know, have they had their bloody show? If they have washed out the mucus plug, and has their water broken? And when it broke, how did it smell? Why is that important?
Indication that the baby had a bowel movement.
Yeah, meconium staining. Yeah, that's true. One of the mothers one time I had that delivered on me, she said, yeah, it looked like cottage cheese when it came out. And I went, not good. So measure their contractions, not only the frequency, but the duration. And how do you measure duration? How long it goes. And frequency is from the beginning of one contraction to the beginning of the next contraction. That will give you the information. And then you want to know, is there vaginal bleeding? And to get that, you got to look. You got to look. So take your time with these. LaDonna, you still here?
Still says on there too, the suction.
Yeah, that's what I was.
Updated.
Thank you very much, Dan. That's exactly what I'm trying to get across here. We are got to get our look at our protocols, and we got to get them updated. Okay. So you're reading ahead. I was going to get to that point. Yeah. Hold delivery of the head, clear mouth, and suction. That is WRONG. That part right there. If I had a highlighter, I'd highlight it. That is not correct. But now that is our protocol. So do you go with what we're teaching, or should we go with protocol?
Technically protocol.
Yeah, technically.
But
What do you think the Dr. Griff would think about this?
I change it probably.
Yeah, and it's digital, so changing it is not a big problem. Just got to get in touch with the right people, who's in
Got
charge
to
of
have
protocol?
administrative people. Yeah.
Yeah, the administrative people or the supervisors or whoever does that. So general supportive care,
Probably
establish an
somebody in
IV,
education, huh?
might be, or might be the chief paramedic. Assist in delivery.
Yeah.
Don't push the infant. Do not pull or push on the infant anytime. Get that umbilical cord out 10 inches from the body, 2 pieces, 1 inch apart. Clamp it. You know, keep them warm. Put them on mom's chest, skin to skin. Do what the OB people say to do, and that's always good. Look for signs for placental separation. This is a slight gush of blood, lengthening of the cord, rising of the rounded uterine fundus. Yep, all that stuff happens when we get placental separation. And we don't want to pull on it. We want it to hurt us to push it out and deliver the placenta, and we want to save it. Don't do it like a lawnmower. Don't wrap it up, Dan, and jerk it like a lawnmower. That's not good. Save the placenta, bring it in, because here they're going to check them for placenta fragments. There's other things they do with them too. And if you have a little bit of bleeding, that's normal. But if you get into a little more excessive, find the fundus, find the top of the uterus, and gently massage it. That will help that uterus to clamp down. The other thing we can do is, if the baby will root, allow the baby to root on the mother's breast. If the baby will suckle, let the baby suckle. Stimulation of the areola and the nipple will cause Pitocin to be secreted, and that will clamp down the uterus and shut down any bleeding that might occur. Now, if the hemorrhage goes, you might think about getting Pitocin, and then we need to check the infant to make sure that they check for any lacerations that's in the vaginal area. And then we need to infuse 10 units of Pitocin in a 1,000 cc bag and run at 150 an hour. That is that one. Now, here's third trimester complications. What kind of things can we get in third trimester? There's 2 of them right there.
The good old abrupto and placenta previa.
Tell me about abrupto. You got a great voice for this. Lay into me on it.
That's an abrupt tearing of the placenta from the uterine wall before delivery, and it is a severe emergency.
Yep. Do you think we need a dose of diesel for this one?
Shit, I know that's what we used.
Yeah.
Hit the ER doors. They said go straight to surgery. And I was like, oh God, they had a surgeon on standby. I said, I hope I ain't wrong. I hope I ain't wrong. Fortunately, I was right. Well, I mean, unfortunately, fortunately, but yeah.
Did the baby survive?
Yes, it did.
That's good. That's what it's all about. You know. Okay. What kind of signs and symptoms are you going to see with abruptio?
Tearing sensation, bright red blood.
Okay, good deal. And the mother may or may not be in labor.
That's right. Mine actually wasn't.
Okay. Severe lower abdominal pain, signs of shock. Was she cool and clammy?
Oh God, yeah, she was diaphoretic. I popped 2 IVs in her.
Yep. And they may have vaginal bleeding, or it may not be vaginal bleeding. We had one of our the director of EMS at Forest City's wife had one of these abruptio placentas. No, she had an abruptio uterus. Ruptured her uterus, and she had no external bleeding whatsoever. She had a few cramps, she had a few contractions, and then the contraction just suddenly quit, and she didn't feel anything. And by the time they got her to the hospital and they figured out what was going on, the baby was dead. She liked to die too in that. With abruptio placenta, you'll get, this is one thing that's really interesting about abruptio placenta. They get that uterine rigidity. Their uterine will actually get rock hard, and it's very palpatable. Usually you can palpate on the woman's abdomen and you feel it's kind of soft, even except when they're in contractions, but theirs will be rigid. Place them on the left side. Did you do that? Place them on the left side? Why don't we
You
place them?
know,
Go ahead.
actually, I can't recall if I did or didn't. I probably didn't. So we were rolling and I was getting IVs, yeah.
Yeah.
Because her stomach felt like a basketball.
Yeah. Um, left side. Left side. Why don't we put them on their left side? What is the deal with that?
Blood flow.
Yeah. LaDonna or Cody, either one of y'all here?
Yeah, I'm still here. What was the question?
Still here.
OB patients, why do we put them on their left side and not lay them on their back?
Well, it's hard to breathe that way. You have all that weight on you, and all that weight is going pressing up against your lungs.
Okay. It also presses on a little bitty vessel that runs down alongside your spine called the,
I know what you're talking about, but I can't remember the name of it.
yeah, it's a positional hypotension because you squash the vena cava, which drops the preload to the heart. You drop the preload, you drop the afterload. Patient can be totally normovolemic, having the right number of volume inside their body, but because you put that OB patient on their back and they squash the vena cava, they get this positional hypotension. And all you got to do to make them completely well is to roll them up on their left side or raise their left hip where you shove the baby's weight off of the vena cava. Isn't that amazing, LaDonna?
Yep, it is.
Okay. So OB patients should be transported on their, say it.
Left side.
Good, good. Just engaging, just engaging. Shock protocol should be done in rapid transportation. Yeah. And it's always nice to contact medical control. They may give you something else to do, but probably won't. Now, the next one, which you won't have to talk about, is placenta previa. And it's painless vaginal bleeding. So here we have a pregnant lady. She's in her third trimester, and all of a sudden she starts bleeding, but it doesn't hurt. And she's soaking pads left and right. And, you get in there and they're saying they're soaking 3 pads an hour. That's a lot. They'll probably call you before they get that far down. But they'll be in shock and it'll be painless. Abrupto placenta, they can have abdominal pain with that one and severe pain. This one, painless. Still the same treatments, general care, IV, left side, shock protocol, and transport. So one's abruptio placenta, the other one is placenta previa. Placenta previa is right over the cervical os. That's the opening into the birth canal. So if the placenta has placed itself over that, then as the dilation starts for delivery, it just starts tearing that placenta apart and bleeding occurs through the birth canal. Now, one thing you don't see many placenta previas anymore. And the reason we don't see very many placenta previas anymore is if they see it's a placenta previa, they schedule the patient into the OB for a C-section before their due date because they want the baby to come out by cesarean section rather than trying to do the vaginal thing because the placenta is over it. Now, if they don't have any prenatal care, if they don't have any care that, before they go in, they don't have an ultrasound, then you could be looking at this. And this is one that scares you to death when it happens. That's the one that I had the midwife did. Okay. All right. So what happened? We jumped goofy here. All right. Complications during fetal delivery. This is 303-16. Oh, look, prolapse cord. General supportive care. I guess that's ABCs. Keep them warm, comfortable, and take it. Gloved hand, palpate the umbilical cord for a pulse. Then cover the cord with more sterile dressing. Do not replace the cord. Mother in the knee chest position or supine position with pillows under her buttocks to help alleviate potential cord compression. You want gravity pulling that baby toward the fundus or the top of the uterus. If the pulse is absent, position does not restore pulse. Insert gloved hand in the vagina and lift the head of the baby off the cord. Keep hand in this position, rapidly transport. Contact medical control because this will also be a surgical intervention. Dan, the way this reads, if the pulse is absent, that's only the time you put your hand in there and lift up.
That's right. I'm sorry, my dog's whining.
Oh, it's all right. Let him whine. It's fine. He's probably heard me talk about this, and he's probably whining, going, "I don't want to do that." But
Hell, I don't want to do it.
yeah, but the preposition there is the pulse is absent. I don't remember seeing that anywhere else, but I guess it's here. So I guess we need to check that cord for a pulse. But you're going to have to continually monitor that cord for a pulse because if she's delivering, that pulse will go away sooner or later. And if it's going to go away sooner or later, why not just go on and lift up on the head? I don't know. It's not my protocol. It is my protocol, but it's not my protocol. You know what I'm saying? All right. Limb presentation. This is the hand, the foot. Yeah, general supportive care. Get an IV. That's good. TKO. Position the mother. Need a chest position or pillows under the buttocks. Rapidly transport. Contact medical control. That's pretty straightforward. If you're going to get a limb presentation, if a hand comes out, rapid dose of diesel. And this is continued on the next page. Oh, here's another one. Cody, what's a breech birth? Do you remember hearing about me talking about breech births?
Anything other than the head.
Got it. That's good. So we're going to do that general supportive care stuff. And this is interesting. Fetus may deliver without complications. May come out butt first. Frank, they call those Frank breech. Both of my boys were Frank breech because they were so obstinate they didn't want to turn around and come out head first. They do prevent stress on the cord. Check before for a pull the loop free or clamp and cut. This is the nuclear cord. It's kind of messed around there a little bit. Got the baby out, keep them warm, put them skin to skin with mama, cover them up with mama. Lift the body using a towel and to deliver the shoulders. If it comes out Frank breech, it's going to come out. You're going to raise the body up to get the top of the head out and then down to get the other side of the head out. Get the ears pulled out of there. If the head sticks, then we've got to open an airway, an air channel to the baby's head. And then if the head is delayed, get you an air wall transport, contact medical control. Pretty well straightforward there. And here's some more. What about this one? Pre-eclampsia or eclampsia. Anybody want to talk on this one? I'm talking too much again. Hey, Greg, you got this one? Can you talk about it? Pre-eclampsia or eclampsia?
Okay, preeclampsia, eclampsia, your signs and symptoms, you're going to be looking at some severe hypertension, can lead to premature birth, which can put a lot of stress on the baby and mother. If I remember correctly, you can lead preeclampsia, if not treated, will lead to eclampsia, and you can end up with seizures, all kinds of other medical issues
So
that I believe you start treatment with if you're. Go ahead.
No, I seem to say the tipping point. Preeclampsia is that hypertension, the swelling, all the stuff that's going on with their body changes. And when they have their seizure, they've gone from preeclampsia, now they're eclamptic. And to stop the seizures, we use magnesium. Two grams. over 3 to 5 minutes. So put them in their left lateral position, give them some mag, contact med control, and get them on in. These are people that are having problems with toxemia in the body. It's the waste products not getting out of the body, and that's preeclampsia, and then it can lead to eclampsia. Okay, very good, Greg. Thank you, sir. And he's right; it can lead to preterm labor. Here again, supportive care, IV, one fluid bolus, 5 cc's, if not contraindicated with preeclampsia. Monitor closely their hypertension for pulmonary edema. Med control, consider a bolus of fluid if they got the preterm labor. Consider the mag 2 to 4 grams over 20 minutes. And then monitor closely for hypertension, respiratory depression. And if eclampsia develops, Valium cannot be pushed through LR. And preterm labor is contractions, regular contractions, less than 12 minutes apart in the 30th week of pregnancy. It says 30th week of, and it doesn't have anything after that, but it's pregnancy is what the word is. It got cut off. All right. So we all concur and probably need to add up the line somewhere that somebody needs to do some reviewing on these protocols, right? Y'all are a quiet group.
I think the answer is yes.
Okay, thank you. All right. Anything else anybody wants to add on this? Gosh, I got 11 o'clock, almost 12 o'clock. It's about time to take a lunch break, right? What's y'all's indication? What do y'all want to do?
How much
can always
longer are we
eat.
looking at? What are we looking at left, KC?
Well, we're supposed to be doing some more on pediatrics. I'm considering thinking about what we need to do on that. Probably an hour and a half more, maybe 2.
Okay, so yeah, I'd say
Supplies, yeah. They like to what? Explore. So they like to climb. They climb up on Daddy's shop. Daddy has gasoline in a Coke bottle because he's cleaning something with it. They see the Coke bottle. They see it that's got stuff in it. They know that's going to taste good. And what do?
May drink it.
They drink it.
Chug-a-lug.
Yeah, chug-a-lug. So that's why you never put stuff, in a very familiar bottle or can or something that they would recognize. And by the way, that Lysol bottle underneath the cabinet has got a green tree on it, and it's the same color as apple juice. So they see.
Your Windex is the same color as every known Gatorade and this, that, or the other.
Yep.
Yep.
Ken Bouvier did a talk at one of the state conferences, and he was showing his Windex, and he was doing it. Finally, took the top off it and took a slug of it. And what it was that blueberry Kool-Aid, berry blue.
Gatorade,
yeah, and that's what it was. It was that same color. In fact, there was a daycare center in South Arkansas. They went out and bought groceries, and they brought the jugs in, and somebody thought it was Kool-Aid, put it in the refrigerator. The kids took a break. They poured those kids glasses of this blue Kool-Aid. It was windshield washer.
Oh my God.
You know, where was her head when she poured that out? By the way, they did shut down the daycare, which is probably a good thing. Uh, you need to have some sort of not ability to read labels on a bottle before you feed it to a kid. There we go. All right. Poisonings. There's responsive, and y'all all know the poison control number, right? You got it memorized by heart.
Memorized my heart, stored in my phone.
No, it's really easy. If you've taken poison and you don't know what to do, call 1 800 222
1-800-222-2.
1222. Don't do all twos. That's a runaway hotline. But it's 1 800 222 1222. Yep. Useless junk. It's up here, guys.
I saved it right there.
Did you find it?
Yeah, I keep it in my phone.
There you go. Yeah, and it works.
I to go poison control. POI.
Yeah. And in Arkansas, somehow that's routed to UAMS and the pharmacy bunch down there, and they'll tell you what to do for these people. We talked about fever already, hadn't we? If they have fever that has nuclear rigidity, their neck is stiff, that may be meningitis. They're running a fever and they're drooling. Don't look in their mouth. You know, that sort of thing. Yeah. What about shock in pediatrics? Can pediatrics go into shock? Is that something they can do?
Yes.
They can go into
More than anybody else.
Well, they're little containers. They don't have as much fluid as the rest of us. What would be one of the common things for them to go into shock with? What would be the biggest of all the things that can happen to them to make them go into shock?
Dehydration.
Yeah, and how do they dehydrate?
Fever, nausea, vomiting, diarrhea.
Nausea, vomiting. There it is. Remember the Pepto Bismol commercial? If you got upset stomach, nausea, vomiting, diarrhea. These guys, if they get diarrhea and they're throwing up in 12 hours, they can be dry as dust. And you need to be thinking about that. Ask them how long have they had been going on and how long have they been throwing up. They can, of course, trauma, that would give you hypoperfusion. That would give you shock. That's one of the common ones. Vomiting, we said, blood loss, infection, abdominal injuries because of the dilation. Now, less common ones are going to be like allergic reactions, poisons, and cardiac arrest. So you're going to see with shock, you're going to get those classic shock symptoms. What are they? Yep, rapid heart rate. Good.
I was waiting on somebody else. I don't want to take them all, you.
Hell, cool.
Yes, Tim.
Yeah.
Cyanosis.
Ready pulse.
Weak pulse, yeah. Not so much with that. And you get decreased urine output. You know, if you got a baby that's having nausea, vomiting, diarrhea, and they're not wetting their diaper as much as they can, they're just pooping it, that could lead to something, let you know there's going to be a mental status change. And when a baby cries, if they do not produce tears, that's not a good sign. So, got to get them airway, got to be prepared to ventilate them, manage bleeding if there's anything there, keep them warm. That's the big thing. Transport them, IV, of course. And you're probably not going to get an IV. You're probably going to need to get a IO. So, there you go. All right. Another thing that kids do is drowning. Why do they drown?
In the bathtub.
Bathtub. Yeah, that's one place. Doesn't take. How much water does it take for somebody to drown? One of those useless information facts that I remember.
Inch.
4 inches. 4 inches
Just
for an
enough to
adult.
cover that nose and mouth.
Yep, if they can cover the nose and mouth, that's enough. And that can occur. And of course, the first thing you want to do with anything that's near drowning is get them back to ventilating again. Now, usually in the 13 to 18-year-olds, those drownings usually involve adult beverages of some type. You know, hold my beer and watch this.
Uh-huh.
Yep. Because here again, I told you, there's no fear in these kids. And they're going to push that envelope, Yeah, I can swim the Mississippi River right here. Famous last words, because you start across that river, it's wider than you think. You get about halfway and you're tired, and then you're dead. And we'll find you down around Baton Rouge somewhere. But yeah, got to remember there's two types of drownings. There's freshwater drowning and saltwater drowning. What's the difference in those two?
Osmosis.
Yeah.
Osmosis, yeah. Saltwater drowning brings fluid into the lungs of Eli. So basically, they drown inside their lungs in their own fluids. Freshwater drowning is just the opposite. It passes right through the alveolar wall into the red blood cells and the bloodstream, and causes hemolysis, and they burst. They just kill lots of red blood cells. In fact, that's one of the reasons why freshwater drowning always wind up getting typed and cross-matched for blood. I always thought that was the weirdest thing as a young paramedic. We go out on a drowning and they want to type and cross-match blood. This person's not losing any blood. And they just kind of look at you, the doctors and nurses look at you and go, you don't know what you're talking about. And then you do a little research and you go, oh, I'm so stupid. I just thought I knew what I didn't know. And then there is a secondary drowning syndrome, and those can happen minutes to hours after it. And all near drowning needs to go to the hospital. You don't pat them on the back and say, well, you just spit and sputtered a little water. No, take them to the hospital, get them checked out. And there's another thing that happens to these pediatric kids, these talking about infants and toddlers. Sometimes during the night, for some unknown reason, they just quit breathing. They just stop breathing. What do we call that when they stop breathing and pass away in the night suddenly?
Kids.
SIDS. Yeah, SIDS. Happens usually within the first year of life, and they don't know why. They do know that it's males, and they're premature males, and they are recovering from a upper respiratory infection. But that's about all they know. And that's one of the things we need to do as pre-hospital professional pre-hospital workers is if you have a SIDS, it's tough time. They love their baby, but they need to send them down to the state crime lab to have a autopsy on them to see if they can figure out what caused this. Because one of these days, somebody's going to send their baby to the crime lab somewhere, and they're going to figure out what causes SIDS, and that will be a breakthrough in medicine, almost as good a breakthrough as the COVID virus vaccine. Have you heard when North Ark's getting theirs? And when are the EMS people getting theirs?
Oh, I know. We don't have an absolute date yet that I'm aware of. I know that we're expecting it sometime here in the near future, and it will probably be ER and EMS that are first in line. I did set Delbert off on something yesterday that the Division of Health the EMS Division of Health is doing a separate one. So I think maybe I don't know, but I think maybe we can tap the Division of Health for EMS and get ones for our crews at the same time and not have to divide what we're getting for our ER. And that way we can splash both at the same time versus just getting in one allotment. Because, and I don't know, I'm speculating here. I'd heard a number like we might get 100 in our first shipment. Well, that's with 65 or 75 EMSers. You're not going to be able to get all ER and all EMS. But if we can tap the Department of Health's Division of EMS and get some from them for you guys on the street, and we can get some for the hospital, then we can probably take care of a big bunch of our very, very front furthermost frontline people and get that taken care of. Now, this is just me speculating. Please don't nail any of that down, but I think that may be a rough estimate of what's going to happen. Sorry, I moved you guys over here to this screen, and so I look away from the camera to look at the people I'm talking at. And
It's okay. We're fine. They were talking about how many doses on the Today Show, how many doses they were going to have by the end of December. And I thought, that's a lot of doses. And then I realized that ain't a lot of doses. So we'll see. They said we might all be vaccinated for it by next December. So we'll see how that works. Okay. SIDS. Baby is recovering we discovered in the early morning. Yep. You try to resuscitate these unless you got rigor mortis. I've seen some that were rigored with the SIDS. Parents are going to be in emotional distress. I have done a slow code on one of these babies where the parents just absolutely were so distraught about the situation. They had attempted 3 times to have babies and had them stillborn, and this was their 4th attempt, and this child had SIDS. And yeah, I did CPR toward the hospital with them behind us with their flashers on, but it was just fingers only CPR, and it was just for the show for them. And I know that's probably not right, but gosh, you have to do what you got to do. Take care of the families, take care of the ones that are still alive, right? Okay, where we at? Let's move on.
That would be fine. That would be fine. And then when they get down here, they should be able to bring, yeah, there. They should be able to bring her there. That way you don't have to circle around, and we can keep this open. Awesome.
we agree.
Concurred. So let's talk about trauma in these infants and children. Trauma is the what? Everybody's supposed to say number one
cause of
killer.
death.
Yeah, leading cause of death for these people. And where do they die? What do they die in? MVCs, right? Bicycle rides, pediatric pedestrians. Yeah. Falls from heights. Yep.
Definitely
Burns.
falls from heights.
Yeah. Sports injuries and even child abuse. So trauma is the number one cause of death for infants and children. And how do we protect them in motor vehicle crashes?
Use the dang car seat, you idiot.
Use the car seat. That's right. And what's the latest on that? They got to be in that thing until they're 16, 17. I think it's 12. Isn't it up to 12?
Or a certain height.
Or certain height or certain weight or something. Anyway, they got to be in there. So use those. And when you get them out of those, put them in seat belts. If they ride their bicycle, they should be wearing
a helmet.
Helmets. But I can't afford a helmet. Guess what? The guy up there in Springfield, that lawyer, he will give you helmets. So you can get helmets. Pedestrian struck, you just got to watch kids. Just got to watch them. They can dart out in front of anything. Heights, keep them out of high stuff. Don't take them down to the Buffalo River. Let them climb up on the cliff and jump into the water where it's shallow. That's not good. Burns, I don't like for my child to shoot off fireworks. I let them use sparklers.
Oh, Casey?
Uh-huh.
So you're talking about falls and cliffs and stuff?
Sure.
We went to the one that, the crag.
Hawkbill Crag, yeah. Mm-hmm.
Yeah, Hawkbill Crag. And these parents were letting their kids walk right next to that edge.
Mm-hmm. Yeah.
Yeah.
Yeah, makes you take a breath, doesn't it?
Yeah.
Yeah.
Kids don't know anything, and so they're just, they're just walking along and stuff, and Like it wasn't even next to the hawkbill crag or anything, but it was still right next to the cliff. And the parents or who are the adults who were with them weren't like holding their hands part of the time and stuff like that. It was scary.
Scary. Yeah, there's a lot of times you get in situations where it's scary like that. You just go, let's leave. Now, why you want to leave? Because I know something bad is fixing to happen. Yeah, FTH, fixing to happen. Yeah, and they're fearless, so they don't mind walking up to a cliff and looking off. You know,
Mm-hmm.
and they go, well, they ain't going to fall off of that. Well, their head's so big when they get up there and lean over, their head just naturally pulls them on over the edge. Okay, the head's the biggest thing they got, by the way. And the airway goes through it, so we got to take care of the airway. And children are going to have head injuries along with the internal injuries, if they fall, because of the size of their head, and which can lead to respiratory distress and respiratory emergencies. Um, they got a narrow airway at the top, so therefore, if they throw up or get anything in their mouth, they can easily choke on it. Candy, hard candy, solid pieces of candy are really bad for these kids. Skittles are okay, but those big red Starburst things, yeah, gobstoppers, those sort of things. Even a hot dog. A hot dog is the perfect diameter of a child's trachea. So hot dogs can get down there and take care of that too. Um, Now, when you get into their chest, thank God their chest is very soft and pliable. We've seen children that have been run over and they not having any problems. They've been run over by a car. I mean, they have a shirt on and it has tire tracks across it, and so and the child not be hurt from that, but having internal injuries. So the outside will be working okay, but the inside is where they often get it's a hidden injury when you get into those. Um, you can get air into the stomach if you're ventilating them and you overventilate them. You can get air in the stomach, and that will cause problems with ventilations. That gastric insufflation is what they used to call it. I don't know what they call it now. And their extremities, when they fall off of their bike going 90 miles an hour down the hill, they tend to flail. And when they flail, their arms and legs get injured. Or if they fall off the cliff at Hawksbill Crag, they probably will flail as they go down. So whenever you get those injuries, you need to be thinking about their arms and taking care of those. And our emergency care is basically keep the airway open and patent. If you think you got a spinal injury, use a modified jaw thrust to open the airway. Give them some oxygen uh, as needed, as regulated by that little pulse oximetry thing. What does that pulse ox has to read before we give them oxygen?
Below 94.
Yes, below 94. So if they're 94 or above, they don't need oxygen unless they just ask for it. So brings us on down into trauma to child abuse. What do you think about child abuse?
I understand it. I don't approve of it.
I'm Casey Jones, and I do not approve of that. Very true. Um, it's improper or excessive actions as to injure or cause harm. Did you like that definition?
Well, it is vague enough to include mental and physical.
Oh yeah, mental, physical. There's probably even financial abuse.
Like,
Child works and gets his check, and then somebody takes it, or she works and gets her check, and then their parents take the money. Going to pay for your raising, girl. Gotta be careful I don't give Jamie any ideas there. Okay. So what's some of the signs and symptoms of child abuse?
They're not going to be, well, I mean, they're already going to be skittish as strangers, but but they're also not going to be too excited about mommy and daddy either.
True. Good one. Anybody else?
Varying stages of bruises.
Yeah.
Various stages of bruises.
There you go. You betcha.
You seem to go for a clumsy child a lot. If your explanation of injuries don't match injuries, if this is a repetitive thing, you go to this house a lot for he's just clumsy and falls.
Yeah. Or the patient that I had that she was standing in the car seat. We had to slam on our brakes, and she fell into the floorboard and broke both of her radius and ulnas. You know, I don't think falling from the car seat into the floor would cause you fractures like that. And then when we took the x-rays, she had spiral fractures in both arms. So this loving parent took the child, this little girl, and twisted her arms enough to break them. Yeah. That parent left with the police. That child went with Child Protective Services. Yep, fresh burns. You burn yourself one time, okay, that's an accident. You burn yourself 3 times on a cigarette, no, that just don't happen.
Yeah, ain't no accident.
Even children learn. Conflicting stories, okay? Fear on the part of the child to discuss how the injury occurred.
Mm-hmm.
Yeah. So
mom and dad at telling how it occurred.
Yeah.
They're not letting the child say anything.
Right. They don't want to cut that loose. That's very true. So don't accuse in the field. That's the biggest thing. Because if you accuse the parent in the field of child abuse, what can they do?
Take the child hostage or just run away with the kid.
They just take the kid. No.
All they gotta do is decline
evidence.
Yeah, we're going to decline care.
Mm-hmm.
And I'm sorry, I love law enforcement to death, but when the parent says we don't want him to go, you can't have law enforcement get involved with that. I mean, you could try, but it really would have to be something really egregious for the law enforcement to get involved with it. So I've tried that one. It didn't work. And I thought it was egregious enough. And the grandmother left with the child and the kids and the mangy dog. And yeah.
And the mangy dog.
And the mangy dog. She was more worried about that mangy dog than she was the children. All right. Yep. Are we required reporters?
Yes.
Yes.
Yeah, we are.
Some people would say mandated.
Yeah, we are mandated. If we don't report it and it comes back that we didn't report it, we could lose our license. And it's nice sometimes to be a mandatory reporter, because when I was teaching at the college, especially over in the tech center, I'd see 17-year-olds and would be kidding around in the hallway, and I know they're kidding around, and he'd reach up and either slap her or hit her or something like that, and I just go out and go, young man, I'm a mandatory reporter, and that was child abuse. And they're like, oh my gosh. Yep. So the other side of that is sexual abuse too, if they get in that kind of situation. So we talked about all these special needs kids, so we don't need to talk about that one again. Let's see. I think we're about to cover that. We're moving through here. That we don't need to do nothing with. I don't think we need to do anything with that. Yep. Oh, is that another hour?
Yep.
Yep. That's good. That's good. I want to go one more place. Y'all bears with me. All right. The clearinghouse, if you will, for all EMS information. David, you looking tough there. You got me up, or you looking at something else on your screen?
I was looking at some of the options on Zoom. Sorry.
Okay, that's fine.
You caught me.
I could tell that blank stare in your eyes there, man. All right. This is the clearinghouse for EMS all across the United States. This is ems.gov. All right. This is, by the way, if you wanted to know what I was doing, I was on initiatives under education, and I was down here looking at some of this core content, and that was what I was using as my practice information, education standards right there, new triage guidelines. We got new triage guidelines. Cody's back. Huh. Okay. I haven't read that yet. I'll have to come back in here and read that a little later. They have newsletters, and you can go in here and read this. This is ems.gov. This is out there with a couple of groups, FICOMS, NIMSAC. These are agencies of the federal government that deal with EMS. It was so funny today. I caught a glimpse of Governor Cuomo in New York City going, "We don't know how we're going to take care of this pandemic pandemic COVID vaccine." And I thought to myself, boy, I sure am glad Arkansas has practiced for at least the last 10 years of how to disseminate vaccines. Because we've got a system in Arkansas that they don't even have in some of these other states. You know, those flu clinics they hold?
Mm.
That's what they're going to do. Anyway, this is all everything about EMS. FICOMS, NIMSAC. FICOMS, I've already talked about these. I won't talk about them again. But there's EMS data, there's advanced EMS systems, preparations, research, safety, workforce, 911. This is COVID here, and this is our response. This is the CDAC situational. A lot of good information out here on this. PPE, infectious control, patient care, pending sample state and law policies. So this is where the movers and shakers for the state of Arkansas come and get their guidelines, their samples, their boilerplate that they use. But it also the other thing I want to show y'all. I'm sorry, I'll get around here to it in a minute. Uh, you still seeing this? Okay.
Google.
Yeah.
Are you under projects?
No, I'm trying to type something else in here.
Oh,
I'm back, Casey. You had to shut down for a minute to be able to use things.
Okay.
I cannot see what you're typing.
Well, I was looking for the. There it is. This is EMSC, EMS for Children. This is another website you can go to and get information about children and areas that you can go in and look. There's hospital-based care. There's pre-hospital-based care. And this is things that we can do. Toolkits, recommendations, transport guidelines, education toolkits. This is some of the stuff I was using a while ago. We was talking about American Academy of Pediatrics. That's the PEP program. There's the BLS, Pediatric Advanced Life Support. What was the one you were saying they needed to take, Brian?
I like pairs.
Pairs is a good one. I'm sure it's in here somewhere. I hadn't got down to it, but there's one called TRIP. There's one here called Teaching Resources for Instructors of Pre-Hospital Pediatrics for Paramedics, Pediatric Disaster, Committee on Accreditation of EMS Programs. Yeah, National Association of EMS Educators. Brian, there's one I was telling you about earlier. EPIC. Yep. Didn't know there was that many alphabet soup programs out there, but this is EMSC, and you can see their focused areas. And there's their funded programs. This is the state partnerships. And I think if you click on state partnerships, Arkansas is one of them. And we do get money every now and then from EMSC for different programs. Yeah, this was my favorite logo of all of the EMSC logos. Little bear with the sling. Okay. But that's EMSC. We're supposed to talk about that. And Arkansas does have an EMSC coordinator. It's through the state health department. What were you asking about the EMS.gov, Brian?
Oh, nothing. I thought that's where you were. Is everybody else's picture? Oh, mine quit now. Everybody is glitching on my side of where I'm seeing everybody.
Oh, are they?
Yeah, I don't know whether that's just, maybe that's me.
Well, we have been on here since 8, so that's
I was just evidently
6 hours.
got tired of you guys being over on that side and wanted me to move you over or something.
Oh, it's probably an operation error. Probably a loose nut behind the keyboard.
At least one.
Oh, yeah. EMSC is not in this EMS.gov. I thought it was. There's a big thing there. Nomenclature. What do we call ourselves? And this is a neat one right here. If you're looking just at neat stuff, this is EMS Agenda 2050, and this is our version of what they kind of hope to see us be in
Who is
2050.
they? The government or?
Yeah, this is all the movers and shakers in Washington.
I'd like to shake some of the movers.
Well,
Yeah.
Let me say this when I go here with that. If there's this group right here, this is the NIMSAC. If you want to take your resume and send it in, they'd love to put you on here. This is for lay people that do EMS work. All these guys right here are involved in that. And NIMSAC did the 2050 agenda. They probably did it in conjunction with the National Association of EMTs and the National Association of EMS Educators, along with the National Association of EMS Physicians, all of those folks. So right there, if you want to join it, just click right there. You can join it. Become a member.
Boy.
Oh boy. Then you could go to Washington, D.C.
Probably they wouldn't let me come out.
This is the people right here that are on there. And public health, emergency management, data, directors, physicians, tribal, all of those.
I'm tribal.
Are you tribal? Okay. But that's EMS.gov. That's not what I was wanting to do. I was wanting to get over here NIMSAC. And it's a public health act. Title what? 19? Of 1910. There you go. Is Arkansas? Look at there. State of Arkansas. State of Arkansas runs it, but in Missouri, School of Medicine is running it there, and in Oklahoma, and in Tennessee, and in Texas. So,
what is Louisiana and Kansas doing, or is that Nebraska?
Other state agencies. Those are other people. I think Kansas is run. EMSC is run by their EMT Association.
Oh.
And I don't think
Louisiana is Bureau of EMS.
Bureau of EMS. Is that
yes,
who
sir.
has EMSC?
Yes, sir.
Well, that's a state agency, isn't it?
Yes.
Well, why do they have it yellow? Don't know. I was going to search something here. If I can get on Arkansas. Grant distribution in Arkansas, yeah. Amount awarded to the state of Arkansas. Is that $130,000? Is that $1.3 million?
That'd be 1.3 million.
Is that 1.3 million?
Yeah.
I don't read numbers that big. The zeros in my bank account is all on this side of the numbers.
What was it you need to say?
Okay. There we go.
Have you had any fever last week? Cough or shortness of breath? Any nausea or vomiting?
Hey, see, I posted a link to the Arkansas's EMSC in the chat.
Have you had a COVID test?
Okay. Thank you. So there is the people that are
Can you
running
open-
our
There's nobody
grants.
there.
So if you wanna get involved, then that would be where you need to go. I see you're flashing up there now. Thank you for the link to the Arkansas grant program. Yeah.
You're welcome.
But Chrissy is the director down there. And that's 6612262. And this Chris Grinder, he's with the Department of Health section of EMS. Yep. 2239. All right. And it's been there since 87. They've bought spine boards. They bought a little bit of everything. So, but we get money from them. Thank goodness. And it's all about getting us to learn more about pediatrics. And that was what today's is all about. So you've got the EMSC link on your, tell you what, let me go, where am I at here? Go up here. Quit, do something right. Thank you. All right, let's try this. Did that come up on your screens?
Hadn't loaded yet.
Hang on.
Yeah.
It's me. It's Ernest T. I'm going back to share again. As soon as I get this
I
up.
can see you, but you can't see me.
Oh, I just got to get this to come up and do what it was supposed to be doing. There you go. Now you seeing it. There is the Arkansas EMSC. Yep. Established a pediatric emergency care coordinator. Wow. EMSC Innovation Improvement, Health Resources, and the National EMSC Data Analysis. What was we talking about a while ago about somebody's wanting to know if that had changed. That was Jamie, wasn't it? Oh wow. Okay. I'm a data dude, okay, so I get excited when I get off in data stuff like that. I cannot do that now. We're in the Northwest region, aren't we? I guess that corresponds to the tracks.
Well, maybe.
It kind of looks like it, doesn't it?
Yeah.
Yep. There are people in your area. I don't know if that will click. It doesn't click on
Don't
that.
threaten me.
What's that?
I said, don't threaten me
Yeah.
with people in my area.
Well, it says here the regional facilitators are available in your region to help you make your agency more pediatric prepared.
More pediatric repaired.
More. Yep. And don't hesitate to contact Cameron Steed. Does she ride in here on a white horse? Sorry. It's dad jokes. That's all I can say.
I understand.
Yep. So, okay, stop it. It's being a little bit contrary today.
You keep your dad jokes in a database?
I do. And we're back to the EMSC in national. Okay. That I'm going to save for later. But in 2050, this is what we're going to have to do with EMS. We've got to be able to be adaptable and innovative. Why? Because who knows what pandemic's coming down the road next. We got to be that way. We got to have inherent, safe, and effective programs. We got to be able to protect ourselves, not only ourselves, but our patient. We have to make sure that we're getting effective care on the streets. We got to make it integrated and seamless. Door to drug. Stroke alert, go to CT. Trauma, don't come here, go there. We got to make it seamless. We got to work on it. It's got to be reliable and prepared. We can't have anything not prepared. We got to make sure that it's there and we don't overload the system. It's got to be socially equitable. In other
And
words,
acceptable.
what's that?
It has to be socially equitable and acceptable.
That works for me. Everybody gets the same break. You don't go, well, you're from Diamond City. We're not coming up there because we know what Diamond City is. But Omaha's okay.
Yeah.
Yeah, there you go. Flatlanders versus hill people. Watch it. Don't get me started. Sustainable and effective. That's another thing we got to be. And all of these are the parts that go into a good EMS system. And that's what they come up with here. And the future starts now. Click there. When you click there, you go back to ems.gov. Do you know you can't get up here to the top of this thing without triggering a... Yeah, there you go. That's the EMS. I got that bar at the top. Okay, so this is a good newsletter to read, EMS updates, because it's from federal partners and projects. Um, there's focused webinars you can go to. In fact, let me slip out here to want something else. Are y'all still seeing my screen? Yeah, no?
Yes.
Okay. Now you're seeing my Gmail.
No, I'm seeing .gov.
Still seeing .gov?
Now I got Google.
You'll catch up with me in a minute. Let me know when you get to the COVID clinical rounds special session.
Monoclonal antibodies?
Yeah.
That sounds like a fancy name for the first wave of the zombie apocalypse.
It could be. And it happened today at 11 o'clock. This right here, this ECHO, this is what they call ECHO project from the University of New Mexico. If you're interested in watching some of these grand rounds, this stuff is awesome. This is absolutely, and you get CMEs and CEs for doing it, and you just sit and listen to these guys talk. They will typically do do them on different days. There has an EMS section, and you can go in there and listen to EMS. This was the people that I was listening to when they actually come up and said, we don't know what we don't know about this stuff. But there's the medical directors. There's rule success and challenges. That'd be an interesting one to listen to, because they go out and bring in all these people. And you see, look here, there's the NAEMTs involved in this, and Aetna is involved in this, and there's a bunch of folks that are involved with this NHTSA, these ground rounds, and this is the ECHO project. And I don't know how I got on it, but I saw something, clicked on it, got involved with it, and I've been going to these things, and I've got my 10 hours, but I like going to them because it's just interesting, some of the case studies they bring up and talk about. And this was one of the first places I heard the part about using the UV light to sterilize trucks. I heard that on here before I saw it here. And this is where some of the movers and shakers are at on this thing. And if you look at some of the groups here, it's been talking. Chair of Excellence in Medicine, professor and chairman at Case Western University, the University of Hospital at Cleveland. Here's at Ohio State University, and here's one here with HHS Asper National Healthcare Preparedness Program. It's pretty interesting stuff. So if anybody's interested in seeing some of these ground rounds, let me know. I will share the link with you.
I know this kitchen chair is kicking my butt.
I know we're fixing to be done. We're fixing to be we are wrapping it up. I was trying to see. I think I got on there. ain't what I wanted to do. All right. And it might be the fact that I have been in several trainings out at the University of New Mexico, and that's how they got me on this thing. But yeah, the Echo Project is what it's called. And
David loves New Mexico.
yeah,
Yeah.
There's an explosives at the Mining Institute.
oh
thing
yeah, yeah.
Go to.
I took that class.
Have you? Did you enjoy that?
Yes, sir.
Did you enjoy them packing the SUV plumb full of amyl nitrate and setting it
Oh
off?
yeah.
Oh,
Oh
that.
yeah, we did that.
Yep. I was behind the
I went to
blast.
that one in Las Vegas.
Hmm.
I went to the one in Anniston.
Yeah. Those are good trainings. And what did it cost you?
Nothing. All free.
All free. Yeah. They set that one off with us, and there wasn't enough of that truck left to do anything with. The biggest thing we found was the air conditioner compressor, and it was embedded into that big concrete wall that was in
That
front of
wall.
it.
Yep.
Yeah. But it jarred my teeth.
Well, you
Now,
were in the bunker, weren't you?
yeah, I was in the bunker, but it still jarred my teeth. It was quite an
I
explosion.
snuck out of the bunker. It went up on the firm outside.
There was pieces
Yeah.
of that
Oh yeah.
SUV falling all around us.
I felt it.
Yeah, I bet you did. Did you have to stick your shoes, your boots, into the commode and flush them before you got on the airplane?
No.
Because of the nitrates that's in the ground, it will set off.
Oh, that. Well, we wore booties. Well, when the one in Las Vegas, they made us wear the Tyvek suits and booties because that was that radiation. Yeah.
We had
That's
just
the
street,
dirty bomb.
we had just street clothes on, but we had our boots, BDUs, But I went out there with the Rural Development Council. It's pretty neat. Pretty neat. We were there.
Oh, it's a fun class.
Was out. Oh yeah, yeah. I like the rattlesnake right there at the gate where they did the blast art stuff. We got to quit that. All right. Any questions? Have you feel like we've got everything done for the day? I have 2:00. That's 6 hours. 5.5, 6.
Yeah, let's call it a day and call it 8.
Well, now I report 6. You report what you want to.
No.
I'm just going to Chrissy and say, Chrissy, we got through at 2:00. We met all the objectives.
Is that the people that's going to do that? Next thing you know, they're going to have an audit.
Oh no, I don't want to audit nothing.
No.
All right, one more time. Brian, you're here. David, do I need to change you back to Bell?
Nope.
LaDonna.
Day's good enough.
Yes.
LaDonna, what is is that your name, LaDonna?
Yes, sir. I was named after my grandmother.
Okay. I'm just trying to remember. I don't think I've ever typed your name before. So, Cody, you still here with us?
I am.
Greg, are you still here with us?
I certainly am.
Awesome. Jamie, maybe. She was given directions a while ago.
Yeah, it sounded like it.
Yeah. Well, I hate to leave before she gets on here because, she left. She dropped out because last time we took the lunch break and I was sitting there eating my food and I heard somebody going, Casey, Casey, Casey. And I put my headset on and she went, I was out for a while. What happened? I said, we went to lunch. She went, oh, okay. But she was there. Listen, thank y'all for coming. I hope this refreshed you a little bit. It helped point you in the right direction. Next Thursday, we'll have a repeat of day 2. Then in about 3 weeks, we'll do day 3. And then day 4, and then that'll take care of the basics. And then after that, we'll do the paramedics.
Can I unmute? That deal you flashed up earlier.
Which deal is that?
Did you not show us the, sorry, I moved my screen again. The dates and times of all the classes.
I don't think it's on there.
Did you put it up? and
This-
show us that? Pat?
This. It's not dates. It's just days.
Okay.
Just days.
So what about the extra time that was added into after the fact?
Yeah. Well, we
Have you
think
created a class 7 for that?
no. I think we've got everything covered. When you do ACLS and when you do some of the individual 10 hours that you got to have,
Right.
I think you're going to come out with that already.
Okay.
The driving, stuff like that. And we'll make sure that you get enough hours, okay?
Well, I'm fine. I didn't. I was just wanting to make sure that everybody else had got it.
Sure.
Got 10 bajillion, but
Now, day one, I had a lot of issues. I had issues even trying to log in today until somebody sent me a link. I think it was Cody.
Sorry.
And day one, I couldn't get in.
You live too far out.
It's not that far. We got electricity.
Well, yeah. Are you on Dish TV, by the way?
Actually, it's direct.
Direct.
Yeah.
Okay. Thank you guys for coming. We may sit here and chat just for a minute, but I don't know what to do about that. Okay. It was about the same length of time as today. I don't know. We don't know what we can do about it. Might be just me and you have to get together and hammer it out.
That's fine.
A mono. Okay.
That's fine.
I'm willing to do that, and I'll do it. For the price of a 6-pack. No, I'm just kidding you.
I'll do a 12.
You got pretty areas out there to take pictures and stuff.
Oh, man. I live right on the lake. I've cleared it down to the water, or not to the core line. You ought to see it. It's beautiful out here.
I've not been invited, David.
Well, then come on. Here, I'll show you a view right now.
Oh, let me look at a view. You're sitting there looking out across the lake right now, aren't you?
Step outside. Now I'm taking down the cedars to improve the view.
Yep.
Oh, yeah. Can you see it?
Oh, wow. You bet.
I've got a lot of cedar down.
Yeah.
I've got deer and turkey in my yard every day.
Deer.
I'm surprised there ain't a deer out here right now. Yeah.
Wow.
Well, we feed them. That's why people kind of sneak out here and poach.
They like apples.
Oh, yeah. And a lot of corn.
And corn, yep. And deer lollipops aren't bad either.
Oh, yeah.
The molasses, yeah.
I think my wife spends more money on critter feed than she does on me. Come on, girl. Come on.
All right.
Come on, girl.
LaDonna, thank you very much. Cody, thank you very much.
Yeah.
Hey, Casey, I got a question for you.
All
I
right.
had caught a call on that last bit.
Sure.
I'm new to this, so as far as getting this stuff, do we have to manually put this in to the National Registry website, or is this going to be done?
For
And
you?
how's this process going to work?
Well, it's always best to do it yourself.
Okay, I
Okay.
thought so because this would be my first time having to research. So since I've got my license.
Cody, I've recerted every 2 years since 1977.
You're longer than me.
I know. I remember when I took Casey's first responder course at NAC like 15 years ago.
Oh, yeah.
Yeah, up on the North Campus.
Uh-huh.
That was like the fourth one I had taken since I started doing first responding at the age of 12.
Oh, my goodness.
And I hope you learned something.
I think I did. I remember one day we were watching storm chasing streams.
Yeah.
Well, are you going to email us the curriculum so we can input it? Or how is it going to work?
Say again.
Will you email us the curriculum so we can input it into National Registry? Because this is counting as paramedic refresher, correct?
Right.
That's what I need.
NCCP, National Core Competency Program. Chrissy is going to give you certificates when everybody gets done.
Okay.
You'll get a certificate suitable for framing or suitable for scanning.
Right.
It says you have gone through all the steps of the NCCP, met the objectives. She'll sign it or I'll sign it. Somebody will sign it and you'll be good to go.
Okay. That's all I need.
I don't think
I've got plenty of CE hours.
Okay.
I mean, I got like 20 hours over what I need actually,
Sure.
but
Well, you know,
better to have too many than not enough, you know?
if you do driving, you know, you get those hours, and
Hmm.
if you do anything else, I mean, if you're just see, I'm doing this echo stuff, and that's an hour every time I sit and listen to one of those guys talk.
Yeah.
You know, so and you can count up to 15 hours of the same thing, but this is
Yeah.
all different. So
Does that, we did that mercury BiPAP, CPAP
yeah,
flow thing. Does that count as
Yeah.
an individual component?
yes,
Okay.
yes. Have you done your driving yet, Cody?
Online, I've
Okay.
completed that.
Well, that's part of it too.
Yeah. Go to FEMA.gov. You can do active shooter.
Oh gosh.
Oh God,
Wait,
there's
wait.
tons.
So we can count FEMA courses because I've got
Yes.
I-300,
Oh, yeah.
all 700, 100, 200, all that.
Cha-ching.
Okay, I'm done. Give me
Oh,
my
yeah.
certificate now.
I think LaDonna was telling us goodbye. I heard her in the background. She's gone.
All right.
Yeah.
I'm signing off
brother.
to get back to the lovely dispatching business.
Okay. See you, Cody.
Casey, just shoot me an email if you don't mind. That way I can get hold of you and we'll work out trying to make up that first day.
Okay. All right.
When's
do it
the
on your schedule.
next class?
It'll be next Thursday, but it'll be the same class.
Yeah,
Okay.
I got to make up day one. Yeah.
Okay, so I don't have to worry about it then.
No, you don't have to worry about it. You have day 2 done. So
Okay.
you'll need 3. You need 3 and 4. Cody, 3 and 4 is what you need now.
Okay, I think I think it may actually be in the ESO that it shows the dates with other courses.
I think it does, and it's going to be January and February.
Okay.
Paramedics will go into March by a little bit.
See you guys.
Thank you. Stay safe.
You're welcome.
Keep them rolling, Cody. I need to reach the charts.
They've been rolling all day.
All right. I like it. When I hear
See you guys.
sirens, I think, yay, I'm going to reach some more charts.
Well, at least they ain't coming for you though.
No, that's true. That's true.
All right, see you guys.
See ya.
Casey, just like I said, if you have my personal email or you have my work
No,
email?
I'm fixing to ask you for your personal email.
Yeah,
right
let's
now.
get that. Okay, it's Officer
Yep.
Bell.
Paper. Officer Bell.
Bell 215
215.
at yahoo.com. I was a police officer and a paramedic for a long time.
My son's a deputy sheriff.
Boone County?
Boone County 14.
Who's your son?
Nathan Jones.
Oh, I bet him. I'm part-time reserve. I did it for 30 years as full-time and a paramedic.
Yeah.
Because when I worked in New Orleans, it was a police department that ran the ambulance service.
Yeah, that's right. That's right.
That's right. Now show them. In fact, when you said Ken Bouvier, I said, fucking Ken Bouvier.
Yeah.
I know Kenny well.
I got a text, Happy Thanksgiving from Kenny the other day.
Really?
Yeah.
I know Ken Bouvier well, man.
Oh, Ken Bouvier. He's taking me down on the.
Yeah, he's funny.
On the canal street down there and got me some Cajun deep fried alligator tail. And I'm gonna
he's
he always told me, he said, I'm gonna take you down on Canal Street and get you some tail. I'd go, Ken, I don't. I'm gonna get you down there and get you some tail. He did. And I went and ate it. It was good. We rode in his EMS cruiser, and he just parked it right in the middle of the street.
Hell yeah.
Yeah. And I thought, we were going along there. He's driving right down the middle of the cable car.
What are they gonna say?
He was going right down where the cable cars go. And of course, you drive down there, they have little sensors that trigger the lights. So you drive along there, it's triggering the lights, and he was just going on.
Fucking old Ken Bouvier.
I said, is that straight? He said, no, it ain't straight, man, but we're gonna do it anyway. Yep. I enjoyed that down there. I served with him on the National Association of EMTs. I was a board member of the.
Yeah, you don't want to work down there. Not as a street paramedic.
He guaranteed me. He said, "You come down here and ride supervisor with me sometime." But that was when he was chief. He said, "You come down here and ride with me sometime." He said, "Before midnight, we'll see 4 or 5 shootings."
Oh, easy.
Yeah.
Easy.
Yeah. Yep.
Those nights I worked, we only had 6 units because that was running.
Mm-hmm.
All 6 trucks would be on different shootings around the city, and dispatch would be calling. Can anybody clear? I got a 34S with 3 people down. It sucks.
Nope.
Because
We
you think
we
you
got
love
this
it, but it
body.
gets old.
We got this body. We ain't going to get another one right now.
That's right.
Yeah. You see my
And
son,
it's
you
not.
tell him you know me and say hi.
I will.
He
I'll call him.
he'll get me sometime. He said, "You know so and so?" I said, "Yeah." So how you know so and so? He said, "There, I met him out there," and he said, "I don't. You know my dad, Casey?" See, he does not play that up. He's lived in that shadow of me for a long time, and he won't tell nobody. He said the sheriff out there didn't know he was my
Yeah.
son. And I met
Yeah.
sheriff at one of the well, I was over at Jamie's local fair, and he come up and said,
Mhm.
"Hey, Casey, how you doing?" That the sheriff, because he knew me. That's one of the guys I like to know in the county whenever I move in. And I said, "I'm doing fine, Sheriff. How are you?" He said, "Doing fine." He said, "Fixing to go into a new job." I said, "Really?" I said, "Well, that'll be
Yeah.
disappointing because my son kind of likes you." He says, "Who's your son?" I said, "Well, he's one of your deputies." He said, "He is." He said, "He didn't tell me you were his daddy, or I might not have hired him."
That's probably why I didn't.
See, I'd always told my son, this is true story. I'd always told my son, I know the governor of the state of Arkansas. That was Mike Huckabee. And in
Yeah.
fact, I went to school with Mike and wrote him parking tickets because he never could park in the right place. But my son was at the elementary school, middle school, and Mike Huckabee came and spoke to the middle school. Big deal. And
Oh yeah.
he was making a tour through here, and he stopped. It was an education tour, and he stopped at the middle school, and then he came out to the college. Well, my son was sitting there and said, "Anybody got a question for the governor?" My son raised his hands. And he said, "Yes, son." And he went, "My daddy says he knows you." And Governor Huckabee said, "Who's your daddy?" He said, "Casey Jones." He said, "You go home tonight and you tell your daddy that the governor of the state of Arkansas said he's a bum." So here we are
That's funny, man.
here we are at the college. Okay, big reception. All the people in the receiving line. The governor's going to come in. He's going to meet the president, the vice president, and write down the pecking
Yeah.
order. He gets three deep into the class, into the room where we're all at. I'm way back over on the very far end, behind, EMS guy. We're way over here. And all of a sudden he turns and he sizes the room up. Is what he's doing. And he points to me and he goes,
Oh yeah.
"Casey!" And here he comes. And he come over there and he grabbed me by the shoulder. He said, "How you doing?" I said, "I'm doing great, Governor." And he went, "I just met your son." I said, "Which one?" He said, "Nathan." And I said, "What did he do?" What did he do? Because I knew my son had done something. He said, "Let me tell you." And he told me, and we just had the biggest guffaw. And his camera guy was taking pictures, and he sent me the pictures of me and the governor just
No
kind of
shit.
like that. Yeah, just laughing out loud, just doing a belly laugh. And of course, people around the room at the college was going, "He knows the governor."
And Mike Huckabee is a good man. I don't care. I like him.
He did a book signing at the Crockett Towers. Now it was the college. And he's doing a book signing, and I just slipped in there. I wasn't going to get this, just gonna wave at him. And here again, he saw me, and here he come. So he's something else. I like him. I do.
Yeah, I like Sarah. I've never met him, but I like the way she handled herself during when she was on Trump administration.
There you go.
Loved it.
Yep, she did. She handled it. He was proud of her too.
I bet he was. I would be.
I like his show.
Oh yeah.
You
Oh
know.
yeah. I listened to it.
So
That's funny.
yeah,
Yeah, we got to meet up in person, face to face. I have to invite you over to dinner or something.
we'll have to do something later on
I'll
when it's
make you
cold.
some Cajun gumbo or something.
Yeah. Mm-hmm. Yep. Oh,
Oh yeah.
I like it. I like some gumbo.
Oh,
Yeah,
it's cold weather.
it is.
It's time for gumbo. Yeah.
Time for gumbo. Get something to stick to your ribs. Boy, it looks snowy out there, doesn't it?
Ah, it's nasty.
Yeah.
And I still got so much work to do outside, man. You see, I'm trying. It's all my life is: go to work, rest up, and then come home and work myself to death. That's why I'm so sore today. I've been lifting cedar logs. I can't even give this crap away, you know?
Can't give the cedar away?
Can't even give it away. Every time I get somebody that says they'll come help me cut it down and get it out of here,
Yeah.
they cut down a bunch of logs, leave me the mess to clean up, take several loads and go make some money, and then don't show back up. I'm just as sick of it.
We wouldn't let them get out of there with the logs, Chief. I mean, no. Hey, hang on a minute. Let me show you one more thing, and then I get off here with you.
All right.
You heard me talking about my bear stick? My bear stick? Yeah. Joe Sexton. I don't know if you know Joe or not.
Sounds familiar.
Yeah, he worked as a.
Oh, that's beautiful.
He worked as a paramedic in up in Alaska. He also worked in Saudi Arabia. He was the only one. He had a lower number like me. He'd been in this a long time. He was a dep.
What is your number, by the way?
Which one? The paramedic number?
Your paramedic number.
Was A057.
That's your paramedic number?
Yeah, 57.
That's the state, huh?
Yeah, my EMT number is 4044.
Oh no. What's your national register number?
Oh gosh, I'd have to look that up. It's a low number too.
I met a guy. He's a Cajun, believe it or not.
Yeah.
800242.
I'll have to look mine up. I don't even pay any attention to that, but when I write my notes up, when I do a test and I complain about something to the national, they look at that number and go, yeah, it's an oldie.
Yeah.
They sent me my 35-year certificate.
Oh, yeah.
But at the end of this bear stick.
I got my 30.
At the end of this bear stick, there's the
bell.
So when you're walking, and this is that scrub brush up there above the Arctic Circle, and you strip it down. They call it a willow or an aspen or something. They get all tangled up in it, but they strip it down and they finish it, put a bell on it. It's a bear stick. So when
that's beautiful.
You walk through the woods and it rattles,
scares
the bears. Or if the bear eats you up, they know it's just not a willow laying there because it's got a bell, and a human had this at one time. That's Joe Sexton. I did his funeral, and he passed away.
Oh,
yep, this year. And he gave me his bear stick before he left. He had like 6 or 8 of these things when he came back. He worked for the Crown Prince of Saudi Arabia as his personal paramedic.
Jeez, okay.
He had some interesting stories. He got in trouble when he showed up in Saudi Arabia to do the contract thing with the king. They grabbed him at the airport. They put him in the armored car, took him to the palace. He walked in and he was wearing his Arkansas Razorback T-shirt, which has a pig on it.
Yeah.
Yeah.
Yeah, that'll offend him.
The king went, no, don't show up with any more pigs on your shirt. He told him it's a logo, and he went, I don't care, nothing. So they, sent him out. Then the crown prince went and took him downtown and bought him a whole bunch of clothes, so he wouldn't wear his Razorback stuff. He got watches, got a fishing pole, But they told him when he was over there, said if the crown prince gets assassinated, you leave. You get out of there because they're going to hold you responsible. Yeah. They were feeding.
Along with him. Yes.
Yeah, they were feeding. He went out in the desert. He said we all loaded up in Range Rovers, and they went Range Rovering out across the desert, jumping sand dunes and stuff. And they got out there to a tent, and they went out and had a banquet out at this tent. And they were passing these things around. He said they looked like white grapes, big white grapes. And he said, they were watching me. He said, I picked one of them up, put it in my mouth, and I realized it wasn't a grape. It was a goat eyeball. And he said, I chewed on that thing and chewed on that thing. But he said, I wasn't going to spit it out and give him the satisfaction of knowing I wasn't going to eat that. He said, they'd hand him stuff. He said, I just eat it. And they'd go, we don't eat that stuff. He said, it's all right, I do. If you eat Cajun stuff, you can just about eat anything.
I eat just about anything, but
There you
goat
go.
eyeballs, I don't know, man.
Yeah, depends on if they're done good. So Officer Bell 215 at yahoo.com.
Yahoo.com.
Okay.
Cool deal. Just shoot me an email and let me know what day you're available, and I'll be
Sure.
available somehow or another.
Sure. Right now, with my mother-in-law getting over her car accident, I don't know what we're going to do about
Yeah,
that.
that's probably difficult.
I'm holding my breath. My wife's over there. I'm bacheloring. Yeah. Yep.
Before I get off here, let's go take a look at this.
What you got?
I was looking at my wife's planner. She was mad as hell at me.
You're going to show me the planner you shot?
Look at the bullet hole.
Oh,
you see the
man.
bullet hole?
Yeah.
It caught right there, man.
Yeah.
It just totally.
It's a good thing it was a
I
plastic
could see the
one.
crow. Yeah, she'd have been mad as hell if it was one of her ceramics.
If it was a ceramic, it might have come back on you.
Oh yeah, she was mad as hell about that.
Oh yeah. Okay. Well, we'll plan to get together down toward the end of the year, and I'll get you.
That sounds good.
We'll repeat that one again. All right. No problem. All right.
All right, brother. You have a good day.
Take it
Thank
easy.
you again.
See you, man.
Bye.
Bye.